If we talk about the abnormality of any hormone, we can talk about the two conditions. That is, one is the deficiency of the hormone, and other is the excess of the hormone or overproduction of the hormone because of any reason. So we have to study these two abnormalities of each and every hormone. Now, starting with the growth hormone, the first condition we are going to study is the panhypopituitarism. Hypopituitarism means decreased secretions of the pituitary gland, and it is mostly related to the anterior pituitary gland. And pan means the decrease in the secretion of all the hormones. So it is a condition in which there is decreased secretion of all the anterior pituitary hormones. The decrease in the secretion may be congenital, that is, it is present from the birth. At the time of the birth, there is some defect in the cells of the anterior pituitary gland, or it may occur suddenly or slowly at any time during life. Most often, it results from a pituitary tumor that destroys the pituitary gland. It occurs after, at any time in the age during the life. Childhood panhypopituitarism. The childhood panhypopituitarism, as I have told you, that it may be congenital and that it is present since the time of birth. In this type of panhypopituitarism, all the physical parts of the body develop in appropriate proportion to one another, but the rate of development is greatly decreased. ठीक है, ये दिस इज़ वेरी इम्पोर्टेंट कि इसके अंदर किस टाइप का जो है ग्रोथ रिटार्डेशन होती है. ये दिस इज़ अ वेरी इंपॉर्टेंट वाइवा क्वेश्चन, यू मे बी आस्क्ड इन वाइवा. All the physical parts are depressed. The growth of all the physical parts is depressed in appropriate proportion to one another. ऐसा नहीं है कि लिम्स छोटी हैं बॉडी लेकिन बाकी बॉडी नॉर्मल है, बल्कि इसमें पूरा का पूरा स्टेचर जो है वो डिक्रीज्ड होगा, वो डिप्रेस्ड होगा. A child who has reached the age of 10 years may have the bodily development of a child aged 4 to 5 years. And the same person at age 20 years may have the bodily development of a child age 7 to 10 years. देखने में एज जो है वो बहुत ज़्यादा होगी, लाइक 10 years है तो वो बच्चा जो है वो 4 years का लगेगा या 5 years का लगेगा. Because of this growth retardation, this condition may be ignored in many people, like जो illiterate people हैं या जो lower class है, वो तो बस यही समझते हैं कि बच्चा वीक है, बच्चा कमज़ोर है. But actually there is panhypopituitarism in the child. The adult panhypopituitarism results from the tumor of the anterior pituitary gland. It may be craniopharyngiomas or chromophobe tumors. These tumors compress the pituitary gland until the functioning anterior pituitary cells are totally or almost totally destroyed. And the third cause may be thrombosis of the anterior pituitary blood vessels. The effects of adult panhypopituitarism are hypothyroidism because of the destruction of the cells producing thyroid hormones, and the depressed production of adrenal glucocorticoids because of the decreased production of, or you can say the destruction of those cells which are producing ACTH. Now, because ACTH releases the adrenal glucocorticoids from the adrenal gland. There is suppressed secretion of gonadotropic hormones so that the sexual functions are lost. So all the hormones of the anterior pituitary gland are decreased in levels, and these are the following effects of the panhypopituitarism. The signs and symptoms of panhypopituitarism include that the person becomes lethargic because of the lack of the thyroid hormones. We'll study in detail about it later on. Weight gain because of the lack of fat mobilization by the growth hormone. As I have already told you about the function of the growth hormone, or the effect of growth hormone on fat metabolism, it causes the mobilization of fatty acids or fat from the adipose tissue. So the body becomes lean. Now, if the growth hormone is deficient, the fat mobilization is decreased, and there is more fat deposition in the adipose tissue. So the person gains weight. The adrenocorticotropic, adrenocortical, and thyroid hormones, all the hormones have the same effect. The BMR becomes low and there is loss of sexual functions. Except for the abnormal sexual function, the patient can usually be treated satisfactorily by administering adrenocortical and thyroid hormones. Dwarfism. Now, dwarfism is the result of panhypopituitarism in children. It can be pan. It can be. There are many types of the dwarfism. It is because of the panhypopituitarism. It can be Levi-Loraine dwarfism, Kasper-Hauser dwarfism, and achondroplasia. These are the types of dwarfism. द पैन हाइपोपिट्यूटरिज्म जो है वो हमने पढ़ लिया है. अ पर्सन विद पैन हाइपोपिट्यूटरी dwarfism does not pass through puberty and never secretes sufficient quantities of gonadotropic hormones to develop adult sexual functions. In one third of such dwarfs, however, only growth hormone is deficient. These persons do mature sexually and occasionally reproduce. Levi-Loraine dwarfism is because in this type of dwarfism, the rate of the growth hormone secretion is normal or high, but there is a hereditary inability to form somatomedin C.